Good afternoon, everyone. My name is Sandeep. I'm a student nurse from Western Sydney University. Today, I will be presenting about the asthma, its pathophysiology, clinical manifestation, and its nursing intervention associated with the case study of Mr. Jackson Smith. Do you know around 2.7 million Australians, which is 10.2% of the total population, have asthma, and it costs Australian health system an estimated $770 million every year? And asthma is one of the most frequent causes for the hospitalization in childhood, and hospitalization for the asthma happens because of the lots of compounding factor and is leading to the sickness. In my presentation, I will be discussing on the high priority clinical manifestation of asthma. Our asthma is a hypoxia. I will also highlight the pathogenesis causing the clinical manifestation by drawing on the case study of Mr. Jackson. In the end, a high priority nursing intervention supplement of the oxygen therapy to address the clinical manifestation will be provided. So in Mr. Smith's case, I have observed his A2G assessment and evaluated him. He has oxygen saturation 92%, and managing his oxygen is a very important priority to prevent from the life-threatening complication hypoxia. In this presentation, I will focus on hypoxia because this clinical manifestation needs to be treated as soon as possible due to the dyspnea. Jackson has a low level of oxygen in his blood. As a result, his respiratory pattern and heart rate are elevated to balance his oxygen. If the lungs retain too much carbon dioxide, which can elevate the level of carbon dioxide in the brain as well. This imbalance of the oxygen and the carbon dioxide in the body is more likely to progress to COPD, which can be more life-threatening. However, if this oxygen level is not treated or not managed at the time tissue cells and body organs may not obtain enough oxygen level to keep them active. As a result, this could deteriorate his condition, which leads to further clinical complications such as cardiac arrest, hypoxemia, ischemia, and cerebral hypoxia. Also, untreated hypoxia and the hypoxemia can lead to hypercapnia, which can progress to the acute respiratory failures. Therefore, appropriate nursing intervention and management is very necessary to manage the asthma patient. Based on the Jackson clinical manifestation, while administered at the emergency department, his oxygen level was only 92%, and during the severe acute asthma, the rapid creation of the allergen-specific IgE or deregulation of the mast cells and discharge series of inflammatory mediator could trigger the edema, hypersecretion of the mucus, and the bronchoconstriction triggered by contraction of the smooth muscle cells all around the airway. This reduced the diameter of the bronchioles, which caused the resistance to the airflow. In addition, airway remodeling that caused the permanent cell change leads to difficulty breathing. The elevated airway resistance and the hyperinflammation prevents the lung from excreting enough carbon dioxide from the blood, confining air in the lungs. When the airway becomes inflamed and the lung cannot exhale enough gas, more gas is trapped inside the lungs, causing the lungs to swell. As a result, intrapleural and alveolar gas pressure increases and alveolar capillaries perfusion decreases. This imbalance between irregular ventilation and perfusion provokes the lack of oxygen in the blood, leading to hypoxia. My high priority nursing intervention associated with the above clinical manifestation hypoxia is to administer the supplemental oxygen therapy as soon as possible. Supplemental oxygen therapy is the most important element of the asthma management. We reduce the inflammation and maintain the adequate gas exchange. As a future nurse, I will put Jackson in the comfortable upright position, which is flower position 60 to 90 degree, which helps relax the intercostal muscles and push the diaphragm away from the lung so that breathing can be more accessible. The upright posture may allow the pressure in the lung, which exhaling may result in improved oxygenation. Then I will immediately initiate a supplement of low concentrated oxygen, start with the 2 liters per minute via nasal pump, and to achieve his oxygen saturation level 90%, 95% or above. This helps to transport the oxygen from the alveoli to the lung and reduce the respiratory distress in the children in the short time period. This may also improve the oxygenation and allow the airway resistance. As a result, the heart get enough oxygenated blood from the lung to the heart and may improve the patient heart rate. This may also help to reduce the chance of having a hypoxia and hypoxemia and increase the blood oxygen level in the body. The supplement of the oxygen may diminish the shortness of breath, enhance the oxygen in the body, and facilitate the heart and lung function. In addition, the improved level of oxygen in the blood may also make the lung more active, improve the heartbeat, reduce the bronchoconstriction, and reduce the inflammation of the airway. And after oxygen therapy, I will reassess the patient every 5 minutes, and if required, I will adjust his oxygen level, slightly increase by 5 to 10% based on his rhesus vital signs. If hypoxia continues and patient deteriorating it, I will consult with the nurse in charge to decide whether clinical review or other CRS calls to be made. Then I will reassess and complete the observation, assessment, and documentation as per organization's policy. It also concludes that from the above, the patient with asthma need oxygen therapy as soon as possible to retain the appropriate arterial oxygen saturation and relieve airflow obstruction in the airway. I want to conclude my presentation by discussing the main ideas mentioned earlier in the presentation. Based on the Jackson-Smith case study, I have provided the clinical focus overview of the severe acute asthma, including pathophysiology, the pathogenesis of the one high priority clinical manifestation, which is hypoxia, and the high priority nursing intervention oxygen therapy associated with that clinical manifestation. The assessment and the treatment of the patient with the hypoxia is a vital aptitude and includes the comprehensive understanding of the pathophysiology, and intensive history taking and center physical checkup is necessary. Therefore, the right and reasonable conclusion of the nursing intervention is very important to manage the hypoxia and then it could be a life-saving to the somebody person with the hypoxia. And this is my last part of the presentation. Thank you for your time.